Welcome, virtual therapists. In viewing this training video, you will better understand how to access the patient and document your encounter. This training video will provide the therapist's experience documenting telephone encounters and virtual visits. A few items to consider to provide an exceptional patient experience. A good environment includes one that starts with a clean camera lens as well as a good camera angle. You want to ensure adequate lighting in your workspace and one that's free of clutter around you. Please silence any personal phones or devices, and you can also make eye contact with your patient by looking into the camera lens. As always, we want to ensure professionalism by wearing our Spectrum Health polo and having the Spectrum Health backdrop in the background. Please have the following applications and programs running prior to the start of your visit with the patient: Microsoft Teams, MedBridge, Spectrum Health Now using Google Chrome, and Epic. In this section, we will see how a virtual visit is documented by the virtual therapist. The therapist opens the multi-provider schedule in Epic to view patients on his or her schedule. Do not use the Snapboard, as it will not allow you to see patients scheduled to you in different departments. Only the multi-provider schedule will. To do that, select My Schedule by clicking the department or provider next to the date. Confirm My Schedule contains your name and the All Departments designation next to it. Open the encounter to begin documentation. Confirm the two following things: patient status has arrived, and you are listed as the provider. Next, double-click the patient's name to open the encounter. Please ensure to link the episode of care to the visit. Enter the visit diagnosis from the patient's previous list. Click the Previous button drop-down arrow and select the appropriate diagnosis for the visit. Next, document the clinical outcomes as applicable. Select New Reading and enter the appropriate outcome as needed. You will document the note using the SMART phrase listed here. Complete the telemed documentation by opening telemed activity. If applicable, select the appropriate reason for MedBridge refusal. Select whether a Spectrum Health template home exercise program was prescribed. Next, select whether the template was modified. Please answer the following next series of questions. If any of the answers are no, then no additional action is required. Document start and stop time of the visit by opening the Time Entry tab. Enter start and stop time of the visit here. Enter charges for the visit in the Charge Capture section. Open the Telemed Charge section to select the correct code for the minutes spent in the visit. Select the appropriate billing codes shown. Finally, sign the encounter by selecting the Sign Encounter button under your note. In this section, we will observe the documentation necessary for a scheduled phone visit. Please log into Epic with your normal login and password and also within your typical department. Therapists should access patients using the multi-provider schedule. It appears as the calendar icon. Again, do not use the snapboard. Accessing patients from the multi-provider schedule will allow you to see your patients scheduled in different departments. Select My Schedule by clicking the department or provider next to the date and confirm that the My Schedule drop-down contains your name and the All Departments designation next to it. Call the patient to start the visit and check the patient in. Once the patient answers the call, single-click the patient on your schedule. Click Check-in. Click through the travel screen that opens. Click Continue to check-in. Complete any needed fields that open. Enter PCP in the Referring Physicians field if prompted, and click Accept. Open the patient encounter to document. Double-click the patient on your schedule to open that encounter. Link the episode of care to the visit if there is an episode created for your discipline. Link the episode of care. By doing this will allow us to track these types of visits with the episode of care functionality in Epic when the patient returns to the clinic for in-person visits again. Next, select the appropriate reason for the visit from the list seen below. Next, select the appropriate reason for documentation. Finally, document your note using the smart phrase listed here. In this section, we will observe the documentation necessary for an unscheduled phone visit. Once the patient answers the call, create the Documentation Only encounter by clicking on Documentation Only Encounter. Search for the patient in the search field. And now click New. Once in the patient's chart, link the episode of care to the visit if there's an episode of care created for your discipline. Linking the episode of care will allow us to track these types of visits with the episode of care functionality in Epic when the patient returns to the clinic for in-person visits again. Select the reason for the visit and enter telephone visit as the reason. Documenting the reason for the visit by entering telephone visit in the search field and click Accept. Document your note for the visit by using the smart phrase below.